everybody. Thank you for coming this afternoon. Some of you are familiar faces and some of you aren't, so I'm going to try and keep this as interactive as possible. If you have any questions, feel free to raise your hand, and I'll also allow time for questions intermittently throughout the presentation. Hi, Kathy. So as Ben said, my name is Kelly Hilborn. I'm a speech pathologist. I work at Menorah Park Center for Senior Living, and I'm here to speak to you today about how speech and language therapy can help individuals living with Parkinson's disease and other movement disorders. Just a little bit about myself. I've been working for Menorah Park for 5 years. I've been practicing speech and language therapy for 8 years. I work primarily with adults, but I do see some pediatric clients as well. So my youngest client is 2 and my oldest is 102, so my day looks very different. I was fortunate enough to become certified in Lee Silverman voice therapy, which has opened so many avenues for me to work with an amazing group of people that are living with Parkinson's disease. And through that, I've made some connections here at InMotion, and I'm just so grateful to be a part of this wonderful community and to be here today. So thank you so much. So just a little bit of a review here. Parkinson's disease affects between 500,000 and 1 million people in the United States, and 89% of individuals with Parkinson's disease experience changes with their speech and voice. And it's estimated that only 4% of these patients receive speech therapy, which is why I'm very grateful to be here today, because it's so critical to get the word out. I don't think very many people and even doctors know what we do and the different areas that we can intervene with. This is just a general overview of the common symptoms that are common in persons with Parkinson's, but it's just important to remember that symptoms vary from person to person. So just because someone may be struggling with one of these areas does not necessarily mean that they will have difficulty with all of these areas. But common symptoms we see are difficulty with speech intelligibility, so making yourself understood, difficulty with language comprehension and use, so understanding messages that are coming at you and then communicating, so getting those words out. We can see influence of cognitive impairments, difficulty with memory, concentration, difficulty with chewing and swallowing, and difficulty with controlling saliva. So sometimes there's a loss of oral secretions, some drooling. So these are the main areas that speech and language pathologists intervene and can help people manage some of these symptoms. The common speech intelligibility symptoms, so when I'm referring to intelligibility, it's your ability to produce sounds correctly, to be understood. We know that with Parkinson's there's a loss of dopamine, and dopamine is responsible for automatic function. And speaking is actually a very complex process, so we have to take a big deep breath in through our lungs, and the air has to move up to our vocal folds, and our vocal folds have to vibrate so we can produce sound, and then our lips and our tongue have to get to the right spot at the right time, and then you have to think of the words that you want to say. So it just really makes sense that when there's a loss of that automatic function, that speaking can become more difficult with people who are living with this disease. The good thing that we know is that people with Parkinson's respond so well to exercise. So when we're thinking about what we're doing, when we're thinking about how we're moving, we can activate and move those muscles more normally. So when we're speaking with intent and with purpose and thinking about what we're speaking, we're using a higher motor tract that's less dependent upon dopamine, hence allowing us to speak more normally. So that's why people with Parkinson's tend to respond so positively to therapy. So why do people with movement disorders have difficulty with speech? Well, going back to that lung, so we have to take a big deep breath when we're speaking, and sometimes with Parkinson's there's a lack of variability in the amount that the lungs expand for breathing. We see impairments in the larynx, so our larynx is what houses those muscles for voicing. Sometimes our vocal folds move a little bit slower, they don't close as strong, so it results in that soft speech and that hoarseness of speech. There's impaired motor control, so sometimes people living with Parkinson's have variabilities in their rate of speech. They might speak rather slowly or they might speak rapidly. Sometimes we see some stuttering with speech as well, and that's can be linked back to that problem with initiation. So similar to that fascination and gait, if there's like a freezing and getting that step going, that can be similar with speech. There can be freezing of the speech and getting those words out. And then something that's fairly consistent is that underlying sensory deficit. So I often, you'll hear people say, I think my wife or my husband needs a hearing aid. They don't necessarily, they don't notice that their voice has become softer. So again, that's why people respond so well to therapy, because when you can teach someone to think about as if they're shouting, then they're speaking at a normal loudness level, hence being able to be understood. So the treatment options that are currently available for speech and voice disorders include drug therapies, neurosurgical procedures like the deep brain stimulator, behavioral speech therapy, and it's a combination of medical and drug therapies appears to offer the greatest benefit for speech dysfunction at this time. So we know that exercise is medicine. There's all kinds of wonderful research coming out now that exercise can indeed change the way that you move and change the way that you do things. So it has to be intense, it has to be complex, you have to do it over and over again, and it has to be meaningful to you, which is getting back to the therapy realm, which is why people, when they learn how to do certain exercises and to speak speak with intensity, they can use those normal movements. LSVT, some of you have seen me present on LSVT. This is just one therapy that's available. It's not the only therapy available, but I wanted to spend a little bit of time on it because currently it is believed to be the most effective treatment available for people with Parkinson's disease. So LSVT stands for Lee Silverman Voice Therapy, and it's a series of intensive exercises that are conducted with a speech therapist for 4 weeks. It's 4 days a week for 4 weeks, and you work on stimulating those muscles of the larynx and the speech mechanism through a series of exercises with the single goal of speaking loud. The LSV protocol is consistent with those theories of neuroplasticity and exercise as medicine because it is intense, it's complex, it gets more difficult as you move along. It's patient specific, and then once you finish, you keep going. So that's why In Motion has been so great for clients, because this fosters the belief that we just have to keep moving and we have to keep doing those exercises to maintain those gains in therapy. I just wanted to share a video clip of a client of mine. She is 69 years old. She was diagnosed in 2012, and she came to see me this summer. So just, you can kind of compare and contrast the difference. This is before therapy. So I asked her to sustain the vowel ah for as long as she can.
At a comfortable pitch. So I'm just going to time you. I just want you to say ah for as long as you can.
So as you can hear, a little bit of hoarseness, a little bit of raspiness, and then this is after she completed the 4 weeks of therapy. So you can hear how the quality of her voice improved. And then this is just pre-treatment, a brief reading passage I asked her to do.
Loudness. The rainbow passage. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful.
And then this is after the 4 weeks of treatment.
Sunlight strikes raindrops in the air. They act as a prism and form a rainbow. The rainbow is a division of...
So you can hear how her vocal quality and stability improved tremendously following completion of the program.
That's after 4 weeks?
It's 4 weeks, yep, 4 days a week. 1 hour session. So we're going to transition into another topic. I wanted to spend a little bit of time on changes with cognition and how speech therapy can be involved with that. Cognitive change, so changes in memory, changes in thinking, it's a sensitive issue. Sometimes the doctor will delay discussing the cognitive impairment out of concern for the person who's just coping with the shock of a new diagnosis of Parkinson's, or because that person might be struggling with those motor symptoms like stiffness and tremors. For this reason, the person with Parkinson's often needs to be the one to initiate that conversation. You should never tell yourself that these problems are too mild to bring up, because the doctor can provide ways to help by perhaps referring you to an occupational therapist or a speech therapist to teach you some strategies to help compensate for some of the difficulties that somebody might be facing. Some of the cognitive influences that we see, so you can see difficulties with executive function. So our executive functions are our higher level thinking skills. I often refer to this as our GPS of the brain. So it's your ability to plan your day, to figure out how you have to get from point A to point B, get there on time. If you run into a roadblock, how are you going to figure your way out around that to get where you need to be? So sometimes with Parkinson's we can see some difficulty with those skills. We can see difficulties with focus, attention, and concentration over time. There can be slowed thinking. There can be some trouble learning and remembering information. Might have difficulty perceiving where you are in space. How can a speech and language pathologist assist with that? So the doctor can refer you to a therapist, and the therapist can conduct a formal assessment to identify specifically which areas you might be struggling with. And therapy can include a combination of techniques. The three main goals are to restore function, to compensate for deficits, and then educate the client and their family on how to modify the environment to make things a little bit easier. So when we think about restoring or remediating function, there are a variety of exercises that you can do, and we'll practice some of those together in a few moments. We can teach internal memory strategies that I'll talk to you about, as well as external strategies. So somebody might benefit from a smartphone app to help them stay on task with daily reminders. And then the education piece is so important. So getting together with family members and helping to identify the deficits that somebody might be struggling with and how they can help their care partner become successful and make things a little bit easier to manage. So just with the general aging process, memory declines sometimes. We have to work a little bit harder to learn and remember things. Things don't necessarily stick maybe like they used to. So some strategies that we use for memory, these aren't the only ones, but these are the main ones that I personally address in speech therapy. VWRAG is the acronym, so V stands for visualize. When you visualize something in your mind's eye, you take an extra moment to really take that mental picture. It's easier to remember. W is my favorite, write it down. If you write it down, you can go back and look to it, and it'll help you to remember it. Repeating, so even maybe going back to when you were in school, if you needed to learn something new, you would say it over and over and over again to prepare. That goes the same for daily things you might need to remember. If you say it over and over again, it will be easier. Making an association, so tying it to something that's familiar to you. That's actually how we build memories. If you can connect it to something that you already know, it's easier to hang on to. And then last would be group. So if you can link things together that are common, it's easier to remember a list that have groups of items rather than individual items on their own. Speaking about language specifically, I hear a lot of times people will say, I know what I want to say, I just can't get the word out. So just some things you can do to help is avoid background noise. Don't rush, pace yourself. If you need to, use shorter sentences. If you can't think of a word, try to replace it with a similar word, and allow time for rest. Sometimes if we just walk away from it and then come back, let our brain kind of reset, that word usually will come out. It's easy for me to say don't become anxious. I do myself when it happens to me. If I can't think of a word, we panic. But that's, if you can just kind of take a deep breath and give yourself a second, it usually will come. I have some just general handouts if you guys want to take one and pass just on some of these techniques I'm discussing. if you want to hang on to those. This pink one is kind of how care partners can help with successful interactions with communication. So let's take a moment and practice some of those techniques together. Now I'm going to distract you guys. We're going to practice some of those exercises that I was speaking about earlier with the voice. Some of you are familiar with these exercises, some of you aren't. The purpose of these exercises are to get those muscles moving in your voice box. Sometimes we can be monotone, or our pitch can be flat with Parkinson's, which is problematic because that's how we convey emotion. We need to be able to change our pitch and our intonation when we're speaking. So these exercises are working on strengthening those muscles as well as increasing the range of motion, so getting up high and getting down low. So we're going to start with our ahs. So I want everyone to sit up nice and tall. We're going to take a deep breath in through our nose, and we're going to hold for 10 seconds. I'm going to time, and we're going to say ah for as long and as loud as we can. We're going to hold for 10. Ready? Ah. Good. That was one. Let's try again. Big breath in. Good, nice job. Let's try one more time, as loud as you can. Very good, nice job. Now we're going to glide up to our highs. So big breath in. Good. Number 2. Number 3. Good. We're going to go down low. Big breath in. Number 2. Number 3. Very good. So exercise, right? You're going to hear me say that a lot. Exercise is medicine. Doing those different exercises are going to help those vocal folds to move more normally, with the most important goal of allowing you to be understood by others, which is what we all want. Okay, I'm going to have you repeat after me in your loud voice. So remember, if you don't feel like you're shouting, you're probably not talking loud enough. Get the phone. Get the phone. Wow, very good. Please pass the pepper.
Please pass the pepper.
How was your day?
How was your day?
Give me the remote.
Give me the remote.
Tell them I'm not home.
Tell them I'm not home.
Okay, last one. Go Tribe.
Go Tribe.
Very good. Okay, so those are just some different examples of exercises that might be done to help with vocal loudness and stability in speech therapy. Okay, we're going to move on to some attention exercises. So I just want you to think about, while staying loud, I'm going to say 3 words, and I want us to try as a group to repeat them back to me.
Before you go any further, you back up to where you were doing the voice exercise. You have to do it every day, but how long per session? 3 times a day? All day?
So when we're this is just speaking about LSVT therapy, that when you're in the 4-week program, you do it 1 time during therapy. Those ahs, you do them 15 times each, and then you do it again at night. So you do the exercises twice a day. On non-therapy days, you're going to do them twice a day. And then after you finish the program, you should continue to do them at least once a day to maintain the gains.
That's only about 5 minutes.
Yeah, only about 5 minutes. And then you constantly practice when you're speaking is using that loud voice.
Okay.
That's the hard part. All right, so I'm going to say 3 words. They're jumbled up. I want you to repeat them back to me to make a real sentence. So we're working on our memory and our concentration as well as using our loud voice. So for example, if I said the dog walk, you would say walk the dog. Book, read a.
Read a book.
Fine am I. To time eat. It out throw. Very good. So as you can see, when we're thinking about something else, it's harder to maintain that loudness. So it takes constant practice, constant energy to speak with intention. One other, I want to just kind of talk about the word finding when I was saying that sometimes we know the word we want to say, can't quite get it out. Some exercises that might be practiced in speech therapy work on categories or groups of words. So that's kind of how we learn our vocabulary starting as a child. We learn in different groups. So we learn our colors and we learn our shapes and we learn about food, and then we build on those categories. So we learn about different types of food and different types of animals. So in speech therapy, we work on reorganizing those category groups because sometimes with Parkinson's those categories can get jumbled up and it results in difficulty getting those words out. So here's just the sample exercise. Do it as a group. There's no right or wrong answer. If you don't feel like saying anything, feel free to stay quiet. And there's more than one answer that can go for some of these. So I want you to think about the letter F is in Frank and tell me a state that begins with the letter F.
Florida.
A body part that begins with the letter F.
Finger.
A part of a car that begins with the letter F.
Finger.
Good. Letter H. A state that begins with the letter H.
Line.
A body part that begins with the letter H.
Hand.
And part of a car that begins with the letter H. Good. So that's just a little mini sample of an exercise that might be practiced with a speech therapist. Any questions? We're going to move on to talk about the next area that a speech and language pathologist intervenes often with people with movement disorders and Parkinson's disease, difficulty with chewing and swallowing. So we use the same muscles for swallowing that we do for speaking, and we know that swallowing is an automatic behavior. And because of the smaller movements that we see with Parkinson's, sometimes those movements involved in swallowing become smaller and slower. Might take somebody longer to chew. The food might stay in the mouth or the throat longer than usual. And this can become a problem because when the swallowing becomes compromised, the food can go down the wrong pipe, for lack of a better term, and can lead to a chest infection called aspiration pneumonia. So the swallow occurs in 4 different phases. I just sort of want to give you a brief review of what it looks like. So this is just the anatomy. Here are our lips and our jaw. Here's our tongue. Okay, going back here where it says pharynx, that's our throat. And then I just want you to pay attention to this little flap right here. That's called our epiglottis. So going down here, going down this pipe, this is our esophagus and our stomach is down here. This is where we want our food and our liquid to go. Here's our voice box leading to our lungs. This is where we do not want our food and liquid to go. This little flap I was telling you about, the epiglottis, that's like your trap door. So when we swallow, that epiglottis closes and it seals off your airway to protect food or liquid from going down the wrong way. Sometimes with Parkinson's, that little flap doesn't close all the way, which can be problematic because then the food and the liquid can go down the wrong pipe. Other than aspiration pneumonia, this can become a problem. It can lead to malnutrition. Somebody might not be getting enough nutrients. It can also lead to dehydration because of not getting the proper amount of liquid that you need to stay hydrated. Some common symptoms of chewing and swallowing difficulty are weight loss, drooling, complaints of food sticking in the throat, a gurgly voice when eating and drinking, because your voice box is sitting right on top of your airway, and so if there's food or liquid sitting there, you're going to hear it in your voice. There can be pain when swallowing and repeated pneumonia. If you're experiencing swallowing problems, they should be reported to your doctor, and they're usually managed by a physician in conjunction with a speech-language pathologist. The evaluation usually consists of what's called an instrumental swallowing assessment. These are the two main ones. This here is called a FEES. It stands for Fiber Optic Endoscopic Evaluation of the Swallow, and the MBS stands for Modified Barium Swallow Study. Both of these assessments are going to give the speech pathologist a good view of how somebody is swallowing and where that food and liquid is going. The difference between the two, this is actually a flexible endoscope that's passed through the nose and goes and sits into the throat, and kind of it's like a bird's eye view of the larynx. The modified barium swallow is done with a radiologist, where they mix different liquids and foods with barium paste, and it takes a video to show what consistency somebody might be struggling with and what exercises might benefit improving the swallow. So how can a speech and language pathologist help with this? Again, patient specific, but some of the techniques can include strategies to help the food and liquid go down safely. Sometimes we modify diets. Sometimes somebody might have an easier time with softer foods. Sometimes somebody might require liquids to be a little bit thicker, so they move slower, allowing those muscles to respond. And then there are exercises, again, going back to that exercise is medicine, so there are plenty of exercises out there that can benefit the swallow to help get those muscles moving normally. These are just some general tips for swallowing. If you feel free, take one and pass it. You know, you should always be upright when you're eating. You shouldn't lay down while you're eating. Try to stay upright for at least 30 minutes after you eat. Take small bites and sips. Use your tongue to sweep your cheeks to make sure there's no food in your mouth. It's good to, as I was just saying, after you swallow a bite of solids, take a small sip of liquid to wash anything down that might be stuck in your mouth if it's too dry or if it's stuck in your throat. Try to take your time when you're eating, and don't talk with food in your mouth, which we all know anyway. So I just want to practice kind of a mock therapy session for swallowing therapy. I can't, emphasize enough, if you are having trouble, please see your doctor, because there are specific exercises that could help, not necessarily these ones. This is just an overview. But one of the exercises that is very common, it's called the Masako maneuver. So our tongue is very important when we swallow, and sometimes our tongue doesn't move back as far as it needs to elicit that swallow. So this is an exercise that we practice to work on strengthening the muscles of your throat and your tongue. So what I'd like everyone to do first, just place these 3 fingers on your throat. You're gonna feel a little bulge, and just swallow. So you should feel something raise and lower when you swallow. That's your larynx. So I want everyone to go ee. You can feel a vibration. Those are your vocal folds vibrating together to make sound. So when we swallow, we want our larynx to go up and down. So this is an exercise. I want everyone to bite down gently on the tip of their tongue. You're going to hold your tongue in that position and swallow while holding your tongue in between your teeth. Try to do that 5 times without taking your tongue out. So I'm sure you can feel it's hard for me. It's hard to do that over and over again. So that's just an exercise to work on strengthening those muscles in the throat and the tongue for swallowing. We're going to practice swallowing strategies. So as I said, sometimes there are different positions and techniques that we can use to make our food or drink go down easier. That trap door, that epiglottis, I was saying, sometimes doesn't close all the way when you're swallowing. So a trick that we can try is everyone, what I want you to do in a moment is pretend like you have something to drink. So when we take a small sip, the liquid gets in our mouth. If we tuck our chin down toward our chest before we swallow, and then swallow the liquid while your chin is in that tucked position, That's going to help gravity kind of work toward your advantage, and that epiglottis will kind of narrow that space to help the liquid go down the right way. So let's just pretend you have a glass of water, take a little sip. Before you swallow, tuck your chin down to your chest, hold it in that tucked position, and then swallow with your head tucked. The last area I wanted to talk about today is saliva control. I touched on this a little bit already, but because of that loss of automatic function, sometimes persons with Parkinson's disease might not swallow as automatically as they used to, so that will result in a buildup of that saliva in the oral cavity. It might happen more when you're concentrating on something else, and the postural changes that we sometimes see with Parkinson's with somebody that might have their head in a forward position can result in difficulty managing that saliva in the mouth. So some treatment techniques that are available are oral motor exercises, so different exercises to strengthen those muscles in the lips and in the cheek to help keep that strong labial seal, that strong lip seal to manage your saliva. Behavioral approaches, so maybe teaching somebody to swallow more frequently, thinking about it more often to clear that saliva out. And there are some drug therapies available to help with decreasing the amount of saliva. So let's practice some of those. So here's an example of an exercise that I might give someone that's having trouble with having those muscles in their lips stay tight and strong. So I want you to pucker your lips out at me like you're going to be giving a big kiss. And hold it tightly for 5 seconds. 1, 2, 3, 4, 5. Good. Let's try that again. Hold it tightly. 1, 2, 3, 4, 5. Good. And one more time. Good. Okay, now we're going to pucker to your right. So we're going to work on those cheek muscles. So pucker out to your right and hold. 1, 2, 3, 4, 5. Relax. And then one more time. 1, 2, 3, 4, 5. Now let's go to your left. Relax. And then let's alternate left or right to left. So that's just an example of some exercises that might be given in speech therapy to work on strengthening those muscles. So in conclusion, years ago, it was believed that therapy wouldn't benefit persons with Parkinson's because it is progressive. And it was believed that therapy wouldn't make a difference. Now we know that that couldn't be further from the truth. People with Parkinson's need intensive therapy. They need intensive exercise, and again, that's just why this place is so awesome, because it fosters that belief we just have to keep moving every single day. And when we think about moving with intention, when we think about speaking with intention, when we think about swallowing with intention, we can activate those muscles to move normally. So that's where the therapist can come into play. They can figure out what exercises and what tricks can help you to activate those muscles normally, and then what you would need to do to maintain that function. Most people with Parkinson's experience changes with their communication or their swallowing. As I said, a combination between drug therapies and behavioral therapies appear to be the most effective treatments currently. I want to emphasize there's no custom-made remedy for improving communication and or swallowing. LSVT voice therapy is not the only program out there to help with voice. The exercises that I gave you today are just the tip of the iceberg of what is available in terms of therapy that can help with the communication issues, the cognitive change, and the swallowing issues. So I just think it's important to be mindful that any good therapy program is going to include your communication partners, so include your spouses, your children, your friends, people that you interact with on a daily basis to help support that carryover, because communication isn't a one-way street. It requires two people. So that is about all I have today.
Question is,
yeah.
Excessive drainage, like from the sinuses into the throat, is that something that could be related to Parkinson's?
It could be related because as well as those muscles that close in our throat, there are the anatomy coming down from the nose as well can be moving a little bit slower, might not be sealing off the nasal drainage, could be related to Parkinson's. But I would speak, I'd talk to the doctor. It could be Parkinson's, it could be sinus,
Sure.
Yeah.
Would you use the normal medications, or is there something special that?
In terms of nasal drainage, I would imagine normal medications. I don't know of any specific exercises for that, but there very well could be. I'm glad to take questions now, and I'll stick around after if you don't feel comfortable asking me in front of the group. I'll be here for a while, so feel free to come up. I have one more handout. These are just some of those exercises that we practiced for the voice that might be helpful at home. So feel free to take one and pass, please. Thank you.
Thank you very much.
Thank you.
Very good. Thank you so much.